Because the care plan and the report of findings, it does not matter how good you are with laser, it doesn't matter how great laser is, if the patient's not there, they're not going to get better. If they're not bought in and fully committed to that care plan, your results are going to be terrible. Like I said at the beginning, our results are right about a 98% effectiveness rate. I think that's pretty good. It's not quite good enough yet, but if you want to hit that 98, 99% effectiveness rate, you've got to have a patient that's compliant, and that starts by getting a good care plan and then communicating it effectively in the report of findings. Okay, so when you're building a care plan, there's a few things that go into it. How many of you guys use like a formal report of findings? Wow, it's going out of style, huh? Okay.
For chiropractic, I do, but I don't for the cables.
But you don't for laser? Okay. All right, we're going to talk about why you should. Because it'll help. It'll help not only from a business perspective, it'll help your patients, and it'll drive better compliance too. So there's a few things that need to go in your care plan. The primary procedure, whatever that is, whether it's chiropractic or dental or therapeutic exercise or laser. In my office, the primary procedure is laser. Everything's built around the laser. But then we have supporting procedures that are done also, right? Any further testing recommendations, re-exams, all that needs to be fit into a care plan if you're going to present a care plan to the patient. Again, build it around your primary technique. Everything else should be in support of that primary technique. If stem cell is your primary technique, you're also going to be recommending additional things with that probably. Those are your supporting therapies that go along with that. If chiropractic is your primary technique and you're going to use laser as a secondary, make sure you build everything around still your chiropractic technique. Now, and this is outside of just laser, but remember, don't be afraid to recommend extensive care if you think they need it. We were talking about bone-on-bone knees just a few minutes ago. That's going to require some extensive care. If you know the patient needs more than 3 treatments, don't be like, well, we could do 3 treatments in it. Tell them, hey, we're going to get to be friends because you're going to be here for 6 months. We're going to get you better. But it's going to take some work. Don't be afraid to recommend that if you feel like that's necessary. But also, if you don't know, and especially if you're newer to laser and you're not 100%, it's okay to recommend a trial of care for a couple weeks. That happens all the time in medicine. You recommend a trial of care on a drug or a particular therapy procedure. And then you reevaluate and see how well it's working, and you adjust it from there. Most of your prescriptions that are designed for long-term use are a trial of care first to see how the patient's going to do it. This is kind of the same way. You can do a trial of care just fine, as long as you communicate it right with your patient and tell the patient, look, I think this has a really good chance of working for you. We're going to do a 2 or 3 or 4 week trial of care, and then we're going to reevaluate and see where we're at. That way the patient knows, okay, we're going to be honestly seeing how this works, and the doctor's positive about it. But if you don't really have that confidence, if you haven't seen this work well, don't fake it. It's see-through. So go with the trial of care if you're not quite comfortable with how the patient's going to do. You don't have to have all the answers. Just tell them what your thought process is. Patients don't normally have a problem signing up with a trial of care.